talking about Cleveland Clinic Heart Health Survey. You know, what Americans need to know or do not know what to do in a heart emergency, and you're here to educate us. So I guess to get started, what are the less common symptoms of a heart attack?
Yeah, so let me just first mention the most common symptoms, because these are the most common symptoms for both men and women. So a heart attack is when your heart muscle is not getting enough blood flow. And so the most common symptoms are chest pain, chest pressure, chest tightness. Some people say it feels like an elephant sitting on your chest, and that pressure can go up to the jaw, it can go to the arm. It's often accompanied by breathing difficulty. Those are all the most common symptoms that should raise concerns about a heart attack. Now, women and diabetic patients don't always get those common symptoms that you hear about. So less common symptoms that you should still be aware of include dizziness, fatigue, sweating, nausea, vomiting, palpitations, feeling like your heart is racing, feeling some numbness or tingling in your arm. Those are still less common symptoms, but ones that can be suggestive of a heart attack.
So what are some of the biggest misconceptions when it comes to America's knowledge of heart attacks?
Well, our survey data from the Cleveland Clinic shows that 9 out of 10 Americans think a heart attack and a cardiac arrest are the same thing. They're actually not the same thing. A heart attack is when the heart muscle isn't getting enough blood flow, as we talked about. It comes with all the symptoms that we described already. A cardiac arrest is when the heart is racing and can't do its job. It's really an electrical problem, and it leads to collapse, and it is in fact fatal. So every American should learn CPR. You should know where an AED or defibrillator is in your building, because if you see someone in cardiac arrest, you could really save their life.
Anymore, the AEDs are more readily available than they ever used to be.
That's right.
Yeah. So the Cleveland Clinic suggested SCAN is an easy way to recognize what to do if you feel like you're having a heart attack and what to do with the heart fails. Can you tell us more about this?
That's right. It's a very quick acronym to help you if you're ever in this situation. So SCAN. S is symptoms. So if you see someone having the symptoms that we talked about, the chest pain, chest pressure, breathing difficulty, you should be concerned about a heart attack. And then C is call 911. You call 911 right away, no need to wait. A is aspirin. Aspirin can be chewed. You should crush it between your teeth. That way you're not waiting for it to get digested. It goes into your system right away. If you have baby aspirins available, that's a dose of 81 milligrams. You can take 2 of those. If you have a full dose aspirin, just take 1. And then N is nitroglycerin. Nitroglycerin is a medication that's prescribed by physicians. It widens the blood vessels in the setting of a heart attack. If you're a cardiac patient who's already been prescribed, then you can take this medication as you're waiting for the ambulance to arrive.
Well, great. Well, where can viewers go for more information?
You can go to clevelandclinic.org/loveyourheart, and there's a lot of great information there.
Great. So is there anything we didn't cover in this interview?
No, I think with a lot of education and knowing what to look out for, you could save someone's life. So it's a very important topic. So thank you for sharing this.
Thank you.